Mental illness is a part of all our lives. It's in all our businesses, it's in all our communities, it's in all our neighborhoods, it's in many of our families.
One of the problems that frequently happens with mental illness is that people are identified as schizophrenics, they're identified as their illness. And what we're trying to do is to get people to see that individuals are much more than their illness.
Employment is a very important part of everyone's life. And for somebody with a chronic disability, a chronic health condition with severe mental illness, it can be even more important because it brings them in their community, it gets them participating in a way that oftentimes they haven't had an opportunity to do before.
You're hiring the person, you're not hiring the disability. So if the person is capable of performing the job, then that's what the employer is looking for.
What we've done in Maryland is work very closely with the Vocational Rehabilitation Division. They have a role, we have a role.
Mental hygiene in the mental health field comes from kind of an understanding, a real knowledge of the implications of severe psychiatric disabilities, the need for ongoing supports that have to be flexible and have to be just in time. They have to be there where the person needs it.
They're experts in helping people to find jobs. They're experts in helping to work with employers.
Businesses looking for employees are looking for those who have the capabilities for the job that they're being asked to do, that they have a strong work ethic, that they know that they're going to show up day in and day out for work, that they have an interest in what they're doing, and that they have, as I said, the capacity, the capabilities to perform the job that's being asked of them. Well, I've always advocated that synergy and working together is the way to go. So in any situation, whenever you can bring a variety of resources together to tackle an issue or a challenge, that's the best way to do that.
It's been really terrific to bring in Dartmouth and Johnson & Johnson. I think it's people that come at it, the issues in a new way. They bring a high energy level, clearly a high level of commitment. And I think it's just enhanced the partnership and the collaboration that we've had. It's really kind of forced us to look at the way that we do business, re-examine that, and really find ways, aggressively explore ways to do business better.
Working with Johnson & Johnson and Dartmouth, the more we can expand this throughout the country and can get people motivated in helping consumers through supported employment, the more we remove the stigma of mental illness, the more we help decrease budgets because we're helping to move people back into society to be independent. And also the more that we can go to legislators and we can say, we are making a difference.
Supported employment is a great thing for business. And I think that it is because it's providing information, it's providing access to a potential workforce. It's helping to overcome stereotypes that may exist within any community, but here we're talking about the business community. It's providing another advocate for and assistance in employment with the person who is charged with helping the individual transition into the workplace in an effective way and making certain that they're able to perform the job that they are being asked to perform.